Good afternoon, everyone. I'm sure when Dr. Kamaldeep talked to me to speak on a topic as a debate, and topic was doctor-centric versus corporate-run healthcare. I thought in myself it can never be a debate. It has to be complementary and supplementary to each other. Doctor-driven and corporate-run institutions. Before I talk, I'll just give you a brief about myself. I am from 69 batch from Maulana Azad Medical College. Was the one who was penalized in 74 strike, which was responsible for the residency system, which we all are enjoying. I could not do my post-graduation. Did a small stint in ESIC, and then after that, I did a small practice. Before that, when I was in Maulana Azad Medical College, I feel pride in belonging to a very ordinary family. I used to sell dissection boxes in Maulana Azad Medical College. Every dissection box used to give me 10 rupees, and 4 or 5 dissection boxes which I used to sell used to get me 50 rupees a month, which used to take care of the first book which I bought during my entire medical graduation was Hutchinson's Clinical Practice, which was at that time costing 39 rupees, which I got from 125 rupees, which I got as my internship amount. In the entire MBBS course, I could not buy a book. Why I'm saying this is important in today's discussion and today's talk. And I went on starting a family practice. From family practice, I started a small and then a mid-sized nursing home. From a small and mid-sized nursing home, I developed a hospital, corporate hospital known as Pushpanjali Crossley Hospital, which was, we started in 2008 and then disinvested it with Max in 2016. And from a person who has been selling dissection boxes in Maulana Azad Medical College, I disinvested my hospital in 4,080 crore rupees. Why this is important in today's context is see, everything is complementary and supplementary to each other. Doctor has to be the center of practice, whether they are doctor-centric hospitals or they are corporate hospitals. Only thing we need to develop our own position in those hospitals. And when I go further, it was said by stars in about processes in USA, perhaps the most subtle loss of autonomy for the profession will take place because of increasing corporate influence over the rules and standards of medical work. I'll go further to say, today's hospitals are successfully being run by doctors and non-doctors. A much debated topic for years has been is the difference in quality of services, profit margins, patient outcomes, or management principles between hospitals led by physicians versus those led by non-physicians. What is a physician-centric hospital? A physician-centric hospital is a hospital that is directly owned and operated by physicians who control how it works and functions. These physicians get to make important decisions about who assists them during surgery, how the operating rooms are run, the type of procedures, the type of drugs, the amount of time spent with each patient, and the quality of care which is to be provided. Physician-owned hospitals generally offer superior care to their patients at a more affordable cost than larger hospitals. I will also take you to the time of 80s, 70s, 80s, and early 90s, and today in the 21st century. If you go to early 70s and 80s, the healthcare in India, for all super specialty work, the affluent class used to go to abroad for getting their medical aid and all that. We were running doctor-centric hospitals, but even then, for super specialty work, whether it was transplant work, whether it was affluent class used to go abroad. But today, we feel pride that corporate hospitals have provided that space where every city, even Baroda, every city in a state, 10, 10, 12, 12, 15, 15 cities run corporate hospitals, and we get many, many, many lakhs and lakhs of patients from abroad, because we are providing qualitative work, we are providing affordable and accessible health care to all those persons. Instead of going there, patients are coming from there. That has been the difference, and that is why I say doctor-centric is also important, and corporate-run hospitals are also important. These are just the sarcasm which they normally say that doctors are pawns, and these are all the press reports which say that doctors are exploited in corporate hospitals. The principles of corporates are: most managerial staff are the products of business management training institutions. Staff prioritize financial concerns of the institutions. Senior consultants can express resistance to management decisions but do not have a deciding say. Patients interact with doctor as if doctor is the employee of the hospital and hence should give the services. But lessons for India are, unfortunately, the Indian healthcare system is following the American model. Corporate-run big private hospitals are slowly becoming the primary care providers also. The small clinics and privately owned practices in India could be decimated in the coming years if the current trend continues. I'll come to specifically on doctor-centric hospitals. A common lower or middle class patient coming from nearby rural areas needs to be mentally prepared to go to a big hospital, as they have to go through all the processes, but here they can just walk in and get treated. Patient can receive care in a more intimate and less stressful environment. At one time, I was running two hospitals. I was running a hospital which was a mid-sized hospital, a 75-bedded hospital, secondary care hospital, and I was also running this Pushpanjali Crossley Hospital, which was a 400-bedded hospital. And the difference was the patients looking at the building of Pushpanjali Crossley Hospital, they used to decide which hospital they can afford and which hospital they should go. You can understand that Pushpanjali Crossley Hospital, a specific class used to go. And when Pushpanjali Medical Center, which we used to run, which was a mid-sized hospital, which we are running for 35, 40 years, it was a next-door hospital, and everyone in the entire locality, which we used to call Trans-Jamna locality, used to come and visit as if it's their home. For anything related to their care, they used to come and they used to take health care services there. With more choices, patients feel more empowered. When working with a physician-owned hospital compared to a traditional hospital, patients frequently feel as if they have more options and more of an opportunity to voice their opinions in the care that they receive. Taking decisions is also important, because you are directly talking to the concerned person, concerned doctor, and what kind of a surgery is required, you need to know, and directly you are talking. What kind of a cost will be involved, you are directly involved with him. What will be the complications, you are talking to directly to the concerned person with whose name you have come to the hospital. And not only that, you also know, because your entire family has been going to that hospital, you know that what kind of a facilities this hospital has and what kind of a care this hospital can give you. You even know the names of some of the employees or some of the executives of that hospital, because that's a neighboring hospital and that is the next door hospital which is there. This model ensures that in critical moments, the most informed decisions are made swiftly. Physicians-owned hospitals are deeply committed to outstanding patient care and critical outcomes. Since they hold a personal stake in the facility's reputation, it is no surprise that this yields outstanding results. Balancing patient preferences with medical realities. In a doctor-centric model, the doctor can guide a patient towards the best medical decisions, I just told you, blending patient preferences with the realities of medical science. leveraging expertise and experience, hyper-personalization, deliver services and care when, where, and how patients expect them. Believe me, many of you here have been working in corporate hospitals, and many of you here have been running your own hospitals. When a patient gets admitted in a mid-sized hospital, you are directly concerned about him. You will not mind if 10 of their relations come and talk to you, want to come out with their anxiety. They want to express their anxiety, and when at the end of the day, they all are satisfied that Dr. Saab has talked to me, and they have satisfied and they have fulfilled all our desires. But it's a distant dream. If you go to a corporate hospital where I was running, I made it a point that if a critical patient is admitted in our hospital, 400-bedded super specialty hospital, and for that critical patient, I made it a point as the chairman of the hospital that on every third day, the medical board will be there. All those specialists who are involved in the care of that patient will be sitting with all the possible relations, including their doctor relations, at one place with our administrator and explain them the outcomes, explain them their financials, and try to satisfy them. Even then, it was a distant dream to achieve this entire thing. One or two of the super specialists never used to come at that time. I'll give you an example with no malice towards that, but a physician, when he used to visit an intensive care patient or a critical patient, used to say, he used to write 5 referrals. 5 referrals is, urea is increased, nephrologist, neurologist. And like that, 3 or 4 referrals are there. And all those specialists used to come at different timings. And the person who is there as a critical specialist or a ICU specialist was the one who was responsible for coordinating with all those patients. By the time this nephrologist used to come and visit all those 8 patients in that ward or the 10 patients in that ward, he used to call bed number 1 ke relations ko bula dijiye. And by the time he used to go on air, that bed number 1 ke relations, because 7th floor down, they used to come up, this nephrologist used to go to the other ward to see that patient. So the patient never even used to face the specialists who are treating you. And that has been the most of the time the issue of discord. I think this can be gapped. But I'm saying the difference between a doctor-centric and a corporate hospital, which is been run, and that is why I say focus on value and relationships, achieving operational efficiencies, reducing costs without compromising quality, burden on patients, and definitely it's cost effective. A doctor-centric model places the onus of navigating this complex landscapes on the shoulders of those best equipped to handle it. This approach can be particularly beneficial for patients with chronic illnesses where continuous expert-led care coordination is vital. It also provides a platform for continuous learning. This commitment to excellence ensures that patients receive care informed by the latest advancements and best practices in medicine. What is actually required? Integrating patient-centric elements, that is respecting patient autonomy, communication and empathy, patient education. My conclusions of doctor-centric this thing is, medicine as a profession will always be linked to its prime beneficiary, that is the patient. Corporate involvement in medicine is here to stay. We need to work into the system then by working around it. It needs to be understood that medicine as a human profession does not lend itself to management practices in the same way as other industries. Their real challenge lies in achieving a successful alliance between providing optimal health care, patient satisfaction, and the corporate goals of employee satisfaction in terms of pay and work ethics, in addition to the cost containment and profits. I, for one, will bridge the gap between both the, doctor-centric and the corporate hospital, because I'm still on the board of a chain, which is at least 4 of their hospitals. I'm on their board. Let me just tell you, what is required and what is going to be the thing for India, for Indian landscape, is a cooperative movement by doctors, but running on corporate principles. cooperative movement of doctors running on corporate principles. See, you don't have to work for managers. You have to hire managers, run your hospitals by managers. And that is what the principle is going to be, and that is what Pushpanjali Crossley Hospital, 150 doctors got together. They collected an equity of 42 crores. We took loans of 75 crores. We started this hospital known as Pushpanjali Crossley Hospital, and with an initial investment of 150, 160 crores. Investment went further. At the end of the time when we disinvested that hospital, our total investment was 288 or 289 crores, with 72 crores of equity from contributions from those 150 odd doctors. And finally, we disinvested because I thought, for one, that business also has to come in my medicine practice, and that is why we disinvested on profit to a chain, and that is what every shareholder of our hospital got the due for which he invested the money. But if we could have been running that hospital on the principles of management on corporate basis, I'm sure that is going to stay. Contributions from doctors, making your own hospital, making your departments as per your desires, and running those hospitals not by yourself, by managers which you keep as managers, by COOs or CEOs of higher qualifications in management, and that is what is the thing which is required. And with these words, I will say, corporate chain has brought us name in the global field. Globally, India is known, and mid-sized hospitals or doctor-centric hospitals are taking us to villages. So this entire gap between villages and the global scene has been gapped with both doctor-centric as well as global this thing. Thank you very much. Thanks a lot.